Amazing jobs about anthropometric. You talk about angles. A relevant detail of this analysis is the fundamental value of the tip and its position. No, we have more or less in 4 or 5 angles that we consider in the face. In all the angles, the tip of the nose is very and quite important. Now, here in the nasofrontal angle, the tip of the nose is a key of this angle. In the nasal angle, the tip of the nose is a key. In the nasolabial angle, the tip of the nose is a key. In the facial convexity, in the angle, in the frontomentonian angle, this one and this one is the only angle that the tip of the nose is not quite important. But let's see a bit of work. I will have this one here, okay. The approach of the nose tip, or point 3 of the ring of 4 points, is from the supratip area heading to the middle of the columella. It is injected in volume and retrograded injection. But let's be a bit more specific. I told you that I enter in the supratip. Okay, we enter in the junction of the lower part of the upper cartilage, or the triangle cartilage, and the upper part of the lower cartilage, or the alar cartilage. Yes? And the searing is in 45 degrees and get in the middle of the columella. Okay? How can I put the searing in 45 degrees? I put the injector hand, I put it in the forehead of the patient. I will show you. Then I put a little volume of 0.05 in the middle of the columella. You could see here, this is the columella artery. This is the lateral nose artery, and this is the dorsal nose artery. Here we have some anastomosis. So if we stay in the middle of the line of the nose, we almost get out of the lateral nose artery, but we work where is the columella artery. This one get very superficial, so we must work in a deep layer. Okay, so I put a volume of 0.05 ml, then in a retrograde injection, I put another 0.05 ml, and then before I get out, I put another volume of 0.05 ml. If we saw the columellar artery, this is an amazing work of Yang Lee in Korea. The columellar artery branch of the supralabial artery is very thin. Almost in the 30% of the cases, we have 2 columellar artery, and they have here in the tip of the nose a huge anastomosis with both lateral nose artery. Some great injector and some great research said that this huge anastomosis almost project us to not have a necrosis in this area. is more common than necrosis in the lateral zone of the nose, that in the tip of the nose, because of this great anastomosis. But one important thing that did research of Yang Lee, that is an amazing anatomist of Korea, said that the columellar artery is in the superficial place. So the injection must be supraperiostic, see, between deep fat and the periostic, supracartilage in this side. Okay, so let's see again. I put my injector hand in the forehead of the patient. In that way, I could have the syringe in 45 degrees. I enter in the supratip and get straight to the middle of the columella. Inject a volume 0.05, retrograde 0.05 again ml, and then getting out another 0.05 ml. So let's see key points on this technique. Always in the middle line. I repeat, in my technique, always in the middle line. Always in a deep layer, no, between supraperiost and deep fat. Always aspirate. I used to in my master class in my office, when we start our master class, I give to my students an empty syringe, and I ask them in the whole master class, that are more or less 7-8 hours of teaching, I ask them to do this: aspirate and inject. You see, aspirate and inject all the time among all the masterclass. Among all the 7 hours of the masterclass, my students do this with one hand. No, because one thing that I see in many injectors, that maybe they know a lot of anatomy, they know a lot of technique, they know a lot of products, but they don't know how to manage a syringe. So one thing that I told them is to move the syringe. The injection always have to be slow and gently. And always inject less than 0.05 ml. In the last session with Yanni van Logem, we talk about this. There is an amazing research of seeing the supratrochlear artery and how much volume you need to close the supratrochlear, and the average of that volume, that amount that you need to stroke the supratrochlear artery is 0.08, but the average is between 0.04 and 0.12 ml. So if you inject 0.05 or more, you can stroke the supratrochlear artery. So we must need to make quite small volumes. And one thing that is important is that the tip of the nose, the point 3 in the Rhino 4 points, is almost the key of the aesthetic of the whole noses. Even doesn't matter if we have a hump, because more or less between 12 and 18 months, the product lost strength. So the tip of the nose start to get down again, no? Here we saw that almost 16 months later, the nose is quite better than in the first rhino that this patient made. But look the difference of this point of the nose, almost with product, and this point of the nose. Now, the aesthetic of the patient changed in a huge way. Okay. What do you think about that, my lovely Kay?
Those are beautiful. I love your technique. I think it's definitely very carefully thought out and very precise. And those points of projection bring the midface forward very nicely. So I think that's an amazing technique. And I think those volumes are really critical for people to keep in mind too, like the information about the small volumes. The nose requires very small volumes.
Yes, I saw that you almost make a lot of approach in the nose. You don't enter one only time, and that I guess that you do that because you put a lot of quite small volumes. Is that right?
Yeah, I think so. And also just to catch the light, like I check the nose from a lot of different angles and I just want to catch the light reflex is so important. So sometimes just injecting in one location maybe doesn't give two tip defining points, which I think looks extra pretty.
Great, great. Let's answer more question. You are okay, Kay?
I'm good. Yes, I have, yeah, like 10 minutes more before,
Great.
yeah, but I'm happy to answer questions.
Here, one attendee, Lucia Corredor, asked in Spanish, how much do you put in each point?
How much, say that one more time.
How much amount you put in each injection? You have
I think like you, 0.05,
great,
probably 0.05 is reasonable, or 0.1 is kind of a lot, but maybe on the dorsal hump, maybe 0.1. It really varies depending on the skin thickness too.
yes,
And
of
someone
course.
who has very thick, sebaceous, oily skin, I'm going to try use the most minimum amount of filler because it can tend to look more bulbous if we overfill.
Great. Here I have an interesting question. Congratulations and thanks to both from Sandra Gomez. My question, what does your emergency kit must have in case of complications? Do you have an emergency kit?
I definitely have an emergency kit. And I think anyone who handles hyaluronic gel fillers, you shouldn't buy the filler if you don't have the emergency rescue kit. So Hylenex is in our office. We have about 800 units available. Nitro paste, aspirin. I have antibiotics, steroids, either injection IM steroids, Depomedrol, or oral Medrol Despac, and antiviral.
Great, great. And sildenafil you
I
use?
don't. It's more difficult to get as a prescription. Like it requires prior authorization on a lot of people's insurance. I haven't been using that. How about yourself? What do you have?
Almost the same things. I have aspirin, I have steroids, I have hyaluronic acid, of course. One important thing to say to the audience is that it doesn't quite enough to have one hyaluronic acid. No, we
Yes.
need to have almost 4 or 5
Yeah.
as minus, no, because we don't know how much hyaluronic acid we will use in some complication. I do have sildenafil. And my lawyer telephone in my kit of emergency.
And the name of an ophthalmologist that you
Ah,
know,
yes, of
trust.
course, of
Actually,
course.
that's an important one in my building. There are several ophthalmologists. So
Yes,
if I was to have someone have a sudden visual change, I would immediately know where to go with that person, because unless you know how to do a retrobulbar hylenex injection, that's challenging too. Like if you're doing injection rhino, you should have already practiced how to do a retrobulbar hylenex injection, which I've done
Yes, of
on
course.
a cadaver, but not a person.
I don't know if you have the same of me. My ophthalmologist use fillers in peri eyes, so he has experience with fillers. It's not almost only of an ophthalmologist.
Oh, really? Yeah. Oculoplastics. Perfect.
Yes. So one or two questions more, and I get you free. Don't you change the rheology of the project when changing syringe and needle?
No, the rheology is the inherent property of the material. So you can change the injection force or velocity of the injection, but that also depends on your hand strength and the feel of your hand. So
Yes, I don't change syringe. I use the syringe of the product, but I thought that when you passed, you do it very slowly and gently. No, no, not very fast.
yeah, very gently. I think that's where people run into trouble when they try to inject fast with high extrusion force of the filler, and that is a problem. And in most other areas of the face too, I'm mostly injecting retrograde on extrusion, not antegrade.
And one last question of crystal detail. Do you use cannula?
I do not. Of course, I use it in all areas of the face, but for injection rhino, I don't prefer it. I think it's very possible to use it, and if I was injecting a lot of columellar defect, maybe that would be a way. But I feel it's blunt, and it kind of gives soft tissue trauma when it pushes through, and it's easy to tear through a very paper thin cartilage as well. So I don't. Yeah.
I use it only in patient with rhinoplastic surgery.
Yeah, that's a good question. Actually, what percentage of your patients are rhinoplasty revision cases, Fernando?
Well, in the last year, 2019, I start to make a research of my patient. I almost have 2,100 patients attendees in
Wow.
2019. In that amount, um, almost the 15% of patient, almost 300 patients
Uh-huh.
have a rhinoplasty or two rhinoplastic surgery before.
Wow. Okay. Yeah, that's definitely a red flag for me. If someone's had 3 rhino revisions, I don't want to inject their nose, period. If they've had 2, maybe I'll do it, but I won't feel so happy to do it. And if they've only had 1, that's okay. I can handle that. But after the second rhinoplasty revision, I'm not touching that nose with filler. There's no reason. And also, they're never going to be happy. That's the psychology of that person.
I'm agree with that.
Yeah.
I'm agree with that. Well, um, I think that we could leave you free. It was an amazing chat.
Very,
Thank you a lot.
yeah, my
Um,
pleasure.
I see here a lot of questions that then slowly I will answer them. Thank you a lot. You are a mentor for me. I love the way that you work.
Oh,
It
thank
was
you.
very important to me, to you, to be one of this select group of nose injector. And so thank you a lot.
Thank you. I respect your work so much from all the way across the world. And I only know you through Instagram, but I feel like you're already my brother. And
I
and
am, I am, I
you're
am.
always welcome in Los Angeles. When I teach my next Mastery of Aesthetics course, I would love if you came and lectured at it. Your techniques are beautiful, and your videos is so emotional when the patients are so happy. I love It's the best thing about injection rhino, wouldn't you agree? Like the happiness you can deliver,
Absolutely.
it's
Absolutely.
life-changing. So I'm glad you guys are all trying to learn, and everything we said, we don't say to discourage you. We just say to give you so much caution, because once a person has a problem, it's devastating to the person, but it's devastating to the injector. Like you yourself feel so devastated. So we just want to protect you from having to go through the hardships, because we've been there, we've done that already, right? And results come with practice, and so much practice. And we make it look easy, but Fernando makes it look easy. It's not easy. It's
No,
really,
no, it's true. It's true. It's not quite easy. Well, thank you a lot to you, to the almost 1,000 of people from all over the world here listen us. The next no sessions, we will talk precisely about complications and use of hyaluronidase in vascular complication. So register please, because we have almost few places free. Thanks a lot to everyone. Thanks, lovely Kay. I love you so much. My sister from LA.
yeah.
I hope we could be together soon.
Thank you. Take care. I hope we're out of quarantine soon, and God bless you guys all.
God bless you. Thank you too.
Bye.
Bye.